Hello, this is Dr. Chad Upchurch, and welcome to our introduction video. We have multiple videos posted on here, and this is the one that I think is a good place to start, hence the name Introduction. What we're doing in this video is it's going to be short, it's going to be simple, but it's going to give you an introduction into how we approach our patient care, how we view you when you come to see us and your symptom. You see, I think these videos are important because our office is unlike other offices that you've been to. Whether it's a medical facility or a chiropractic facility, we're doing things different, and we're getting some really good results by doing things different. But today we're going to focus on a huge difference between our office and most offices, and that's in how we set our goals up for helping you get well. You see, when you go to most offices, again, whether it's medical, chiropractic, or anything in between, when you start to list your symptoms, well, I've got this symptom and this problem, ultimately what ends up happening is you get some sort of a label. A diagnosis is really what the technical term is, but it's a label. And there's some benefits to labels, but there's some negatives to labels as well. And the negatives really concern me. I have some real concerns with it. And that is, when you get a label, there's a certain treatment that goes with that. More than likely, if you're listening to this right now, you probably have a label. Your kids may have labels. Your husband and wife may have a label. And those labels can be anything from high blood pressure, polycystic ovarian syndrome, depression, ear infections, ADD, ulcers, diabetes. These are all labels. They mean that your symptom or your group of symptoms is called this or labeled this. This is the diagnosis. And that's all fine and good, except that what I don't like is what follows this. Once you get your label, which unfortunately for many of these it's a lifetime label. You have diabetes for life. You have high blood pressure for life. You have ADD for life. You have anxiety for life. These are the things that I don't like, because these labels hang with you for life, and they what comes after the label is the treatment. And the treatment is always some sort of symptom relief. It's either a prescription medication, or if you're at a chiropractic office, it's a specific adjustment, but it's all designed to treat the symptom. Okay? You have high blood pressure, here is a medication that will lower your blood pressure. You have low back pain, here is an adjustment or a massage or a stretch that will treat that symptom. And the problem with that is that if all we're doing is treating the symptom, then you don't actually get healthier. What happens is you actually continue to get sick. You see, I learned this the hard way in my office. I had people coming to me, and I was helping them with their symptoms. That's what they wanted. Low back pain, here, this will help with low back pain. But over the years, I was seeing them continue to get more unhealthy. And as we treated them more of their symptoms, when they took more medications and treated their symptoms more often, they always became sicker. And the reason is that we never addressed the underlying problem. And the underlying problem is that they're sick. They may be a little bit sick, or they may be a lot sick. And so this is the discussion that we have with our patients, is no matter what the label is, whether from as bad as cancer to just having headaches, no matter what the label or the diagnosis is, you fall somewhere on this continuum. And if you have symptoms and you have problems, you're going to be on the sick side. Okay? So what makes more sense? If you're on the sick side of the continuum, should we continue to give you medications for those symptoms? Should we continue to give you adjustments or massages to make those symptoms feel better? Or should we do what we do in our office, and that is say, okay, here's the problem. You're on the sick side, and as long as you're on the sick side, you're going to continue to have symptoms. You're going to continue to have the symptoms you're having, and you're going to continue to have new symptoms. So what would it take to move you from the sick side over to the well side? And if we move you from the sick side to the well side, isn't it logical to assume that many of those symptoms, because of being sick, would also get better and improve? Absolutely. And this is exactly how we set our office up. When you come in to see us, whether you have diabetes, or whether you have a child that's having chronic strep throat or ear infections, or whether your family's having difficulty having a baby, or Crohn's disease, or anything else, we are not going to lay out a plan to treat symptoms. what we're going to do in our office is lay out a plan to help you get well. And so the side effect of that is when we're done with you, you're going to be healthier than where you started. And it's very possible and likely that the symptoms that you came in with will also be better. Now, does that mean every problem that ever comes into our office gets fixed and instantly? Nope. Sometimes we've got people that come in that they've waited too long. They have too much damage, and we have to deal with that. But still, the best way to deal with those problems is to get back to being healthy. Give your body a chance to heal and function as God intended it to. And that's where our results come from. And we do get some great results with our patients. Now, let me give you a different way of looking at this. This is a little analogy I use with my patients, and it's a little question. I want you to answer this question for me. I know I won't be able to hear you, but you can answer it in your head. And that is if I put you in a dark room, a pitch black room, no light whatsoever, just like the screen. If I put you in that pitch black room and I gave you this objective, here's what I want you to do. I want you to remove the darkness. What would you do? How do you remove the darkness from a pitch black room? Think about that for a minute. What would you do? Well, almost 100% of the time when I ask this question, the answer I get is simply this. Turn a light on. Open a window. Light a match. Right? And that makes sense because that would bring light into the room. But does that answer the question? The question is how do we remove the darkness? This is actually adding light. Did we remove the darkness or did we add light? You see the difference? It's a subtle difference, but it's actually a big difference. See, this is the way that I view health and disease, is that when you come into my office, I can't remove the symptom. I can't remove the darkness. I don't have the ability to remove an ear infection. I don't have the ability to remove a migraine. I don't have the ability to remove, irritable bowel syndrome or anything else. I can't take those away from you. Now, the symptoms can be treated, grant you, but I can't take that disease process or that malfunctioning process away. But here's what we can do. We can add light. We can add light to your body. Now, what is light? Light is health. We can add health to your body. And as we add more and more light, or as we add more and more health to your body, guess what disappears? The darkness. The darkness goes away with the more light you add. And it's the same way with your body. The more health you add, the more the darkness goes away. And that's where the results come from in our office. Now, here's the question. Well, how do you add more light to your body? Well, let's don't overthink this. Getting healthy is a very simple process. Your body wants to be healthy. We just have to give it what it needs. Well, what does it need? Well, we've narrowed it down to 3 basic things. The biggest problems that we see with the people that come in our office is, number 1, nutrition's terrible. Our society has horrible nutrition. Not only do we eat horrible foods, man-made foods, processed foods, fast foods, nutritionally depleted foods, but even if we try to eat healthy and eat our fruits and vegetables, even those foods have problems with them, with just pesticides and genetically modified foods, and they're depleted in their vitamins and minerals. So nutritional changes are paramount to most people's success in getting healthy. Now, this may or may not be the first thing that we address, but it is a big one. And the stats are out there. Over 30% of Americans are obese at this point. 40%, close to 40% of Tennesseans are obese at this point. Our children are becoming obese. We're seeing high blood pressure and high cholesterol and diabetes in preteens and teens and early 20s in people. Our nutritional problems are creating health problems. And if we don't address them, then it's going to continue to cause you to treat those symptoms, which means you're going to continue to be sick. I do have a video also posted more specifically on this, especially on the obesity epidemic. It's called our LifeSource Wellness Weight Loss Program, and so you can watch that video if you want to. That gives kind of the ins and outs of how we specifically address this, because we have some people that come to see us and all we do is change their nutrition, and that's where they get the results and get healthy. A second one that we do is we talk about exercise. And exercise is extremely important. It's almost as important as the nutrition part that we talk about. But we go a little bit further with exercise. We don't just say, hey, you need to be exercised because it's good for you. We really go into the benefits of the exercise. We start to explain to you how exercise and movement helps your posture. And bad posture affects your nervous system, which I'll talk about in just a minute. Exercise lubricates your joints and keeps them moving the way they want to, and saves your knees and your low back from deterioration. Exercise is vital for helping you sleep at night. Exercise is a fantastic way of dealing with stress and anxiety and depression. Exercise is a vital nutrient that we have to have, and it's one of the tools we use to help people get healthy. The third tool, and in my opinion the most important tool, in fact it's so important that we will also dedicate a video just to this. It'll be our next video, and that is proper nerve function. And this may be new to some people, but your nervous system is your brain, your spinal cord, and your nerves. The reason this is so important, in fact, I tell people that this is the foundation of all the results that we get in our office. This is the foundation to recovering your health, to getting off medications and getting away from disease and symptoms. You have to start with a proper nerve function. Well, why is that? Well, your nervous system, the brain, the spinal cord, the nerves, controls every function in your body. For you to be able to see and hear, for your skin to feel sensations like the touch of a newborn baby, for your heart to beat, your blood pressure to regulate, your body temperature to regulate, your immune system to work, your digestion, your hormones. Every single cell inside your body, every organ, every tissue is under the control of this nerve system. So it makes sense that if your body's not functioning properly, we should look at the system that makes it function. And we do that. And unfortunately, we find a lot of problems in people's nervous systems these days. If we correct that, that alone gives us miraculous results in our office. Just doing that with patients, getting their nervous system better, has given us great results with our patients. And we will dedicate an entire video just to that I think you'll enjoy. So what I hope you're getting out of this at this point is the simplicity of what we do. You're not going to come into our office and have us lay out a treatment plan to treat your symptom. You are going to come into our office and lay out a treatment plan to help you get well. And the byproduct of getting well is your symptoms get better. So it's a win-win. You get what you want, but we get to help you with what we want, and that's to help you get healthy. So here's what I want you to do. Think about this information. If it appeals to you and you want to know more about it, because I know this is just an intro, contact us. Set up a time to meet with me. Come by, talk to me about your children, talk to me about you or your spouse, and set up a time. I'll go through everything in detail with you. We'll talk about all your health history and your symptoms and medications and what we can do about it. And I'll be honest with you. If I don't think I can help you, I'll tell you. And I'll tell you where you need to go, or that you may need to stay on medications or go a different route. But if we can help you, then I'll talk to you about what we need to do that. So to call us, the area code 615-441-6115. You can reach us at our website, mylifesource.net. You can also email us, lifesource@comcast.net. And of course, love for you to watch more videos on YouTube. And go to our Facebook page. Like us on Facebook and look at the testimonials on our Facebook page. Look at the pre and post pictures of people. Look at the results we've gotten with children. Check us out and contact us. Hope you enjoy it. Can't wait to talk to you on our next video. Have a great day. This is Dr. Chad Upchurch.